Hello, everyone. My name is Gitika Gorthy, and today I am very honored to be interviewing a very special space champion, Dr. Posselt. Dr. Posselt is a specialty registrar in aviation and space medicine. She is so amazing that she has degrees in science, aerospace physiology, and aerospace medicine. She is Britain's first space doctor who wants to solve the problems of women in orbit. She is a unique woman with large and attainable ambitions. I'm so excited to be able to talk with such an inspirational and amazing woman and learn about her journey of what really got her into space and astrobiology. Welcome, Dr. Patel. Thank you so much for taking some time out of your busy schedule to conduct this interview.
Gitika, it's an absolute pleasure, and thank you very much for inviting me. What you're doing is amazing, and you've interviewed some incredible people. So I love that you're spreading the word about all things space and trying to open it up to as many people as possible. So it's lovely to meet you.
Thank you so much for your kind words. I've read about your work, and truly, some of the things that you've been doing and getting into in your career is just so remarkable to study about. And so, before we get into jumping into your research, first, I'd like to understand more about your typical day. I mean, what do you currently do, and how does it run?
Sure. Well, at the moment, I'm taking some time out of my normal aerospace medicine job to do a PhD. So I'm over in the US on an exchange posting with the US Air Force. And so my day-to-day job at the moment is running research. We've had to adapt our protocols quite a lot with COVID to include lots of cleaning and sanitization, but we're lucky to be able to go ahead with our human subject research. So I'm investigating human performance with helmet mounted display systems that aircrew wear inside aircraft, and they use them to fly the aircraft, and it's a part of the system, and investigating medical standards. So on a daily basis, I wake up in the morning, I try and get some exercise in, get the family out the door, and then I'll go to the vision lab, which is where I work, and I'll get set up for the day for running subjects. So cleaning extensively, and we have a big flight simulator, kind of 270-degree view, and we've got this helmet mounted display. So we get a subject in, I sit them, and we have different setups and different displays that we're seeing how they perform in this flight simulator. So collecting all the data, trying to analyze it, and write up some of my methodology and paper in the meantime. But my normal kind of aviation and space medicine job in the Royal Air Force varies on a daily basis. So one day you could be teaching aircrew about hypoxia or centrifuge training, G-force. Other days you could be running trials. You could be working on a new piece of equipment, integrating it into that aircraft. You could be doing accident investigation, trying to work out the causes of a crash. You could be writing a paper or a presentation, and do a lot of student outreach as well. So yeah, it's really varied.
Yeah, I think yeah. And I feel like space is very interdisciplinary. So you can combine so many different subject areas, whether it be the medicine aspect, the computer science, the research. There's just so much going on. I think that's one of the best things about space. You can combine so many things and technically have like 5 jobs in one, which is just amazing to hear.
And the thing I love about space medicine in particular, aerospace medicine, is that we need doctors in every single specialty to get involved. So a cardiologist who specializes in space cardiology, or an ophthalmologist, an eye doctor who specializes in space ophthalmology, and as the kind of core aerospace medicine professionals, we use the knowledge from each of these different types of medical specialties. So really, we need absolutely everyone and anyone in their own specialties to get involved.
Yeah, and I feel like people are always confused, like what's the track to get into space medicine? And especially when you're specializing, do you just study to become a doctor and then take a separate course related to space, or what's the track for students to go into space medicine?
So I'm always cautious when I give this advice because things are very different in the US to the United Kingdom. So I can only tell from my personal journey and some of the experiences and stories I've heard from colleagues in the US. So in the UK, aviation and space medicine is very small. So you cannot study space medicine on its own. Aviation medicine is really the fundamentals to everything in space. So the two are linked very closely together. Now, aerospace medicine has always existed, but it was more of an apprenticeship, and it was only really done through the military. To bring it in line with all of the other specialty training, the updated training curriculums, in 2016 it was recognised as its own independent new specialty that had a curriculum to follow, that any doctor in the UK could start training. However, the way that training works in the UK is most specialties are funded by the National Health Service, so that post would be funded. Aerospace medicine is not NHS funded, so there has to be a sponsor to pay for your training. In the UK, there's only two organisations at the moment who do that, and that's the Royal Air Force, the military, and the civilian world is the CAA, the Civil Aviation Authority, equivalent of the FAA in the US. So those are the only two ways to do it. At the moment in the UK. When I was going through, I was one of only two trainees, so we were kind of the first trialing out the curriculum. So it was actually pretty hard to direct your training, and there's really not actually that much space medicine in the UK. So for those areas of the curriculum, we had to seek some opportunities abroad. So to cover those competencies, I joined the Austrian Space Forum as a medical officer with Dr. Rochelle Bello, who you've interviewed previously. And I also spent a summer at the International Space University, which is a really incredible experience and opportunity. And I highly recommend that to anyone. And the other ways to get involved, particularly in the space side of things, is to join some of the bigger organisations, so like the Space Medicine Association, which is an affiliate to the Aerospace Medical Association, and link up with other like-minded people. So AMSRO, which is the Aerospace Medicine student and resident organisation as part of aerospace medicine, that they kind of highlight all these opportunities. I think there is a very different, well-established pathway in the US with actual operational space medicine jobs. Whereas that's not the case in the UK. It's much smaller, and it's very much more aviation focused than the space medicine focused. So to answer your question though in how to get into it, I really suggest you just try and ask as many questions as you can, because it's really difficult to find information about it because it's not a very big specialty. So that's the most important thing. First of all, just try and find out as much as you can about it. Find out some of those organisations, and in the UK it's the Next Generation of Aerospace Medicine is kind of the group for kind of early career professionals looking to find out more about it and find some mentoring opportunities and just hear a bit more about what's going on. So ask questions, go to conferences, and you know what, it's a really small specialty, so you'll end up, people start to know you, and then when opportunities become available, you know, that's how you find out about them.
Yeah, I definitely agree. And, space medicine is a small sector in general across the world. And so, of course, in every country, it's small. And US, as far as I'm aware, there's only one medical school that offers a space medicine pathway program that I know of. And it was the Baylor College of Medicine. And they actually have specifically a space medicine pathway program for students. But then again, it's not a very popular career. So there's just so many ways. And the International Space University is specifically focused on interdisciplinary studies in space. So I think, there's so many amazing space programs for everyone to look into. Yeah, and you were mentioning, space medicine is very small in the UK. So I'm curious, how did you find out about space medicine and how did your passion for it ignite?
So going back to kind of when I was a kid, I went to the Kennedy Space Center, age 10, fell in love with space and just the sheer amazingness of sending and supporting humans to space was just incredible. I always loved flying, and I kind of loved medicine. And so for me, going into the military, into the Royal Air Force was like a dream kind of job. I then, once I was at university, I was doing my medical degree. I found out about aerospace medicine. So I did an undergraduate degree in aerospace physiology. And then I really understood that you could study the human body at this extreme environment. So to start with, it was really aviation side of things. I was lucky enough to present my work at the Aerospace Medical Association one year. And that's when I met this international community and really started finding out about space medicine. And I was like, oh, this is incredible. This is what I want to do. So I then went on a career, on a path of about the next 5 to 6 years of pestering people and saying, I want to do this, I want to do this, I want to do this. So in 2016, when the time came that the specialty was just recognised, and the RAF were going to take it on risk to train me, I was very lucky to be in the right place at the right time. And as I was one of the first trainees to go through, I had a bit of flexibility to organise my own training. So I sought out opportunities like the Austrian Space Forum and International Space University. And I was able to go to my supervisor and say, hey, this is on the curriculum. This will cover it. Can I go and do this? And often they'd say, okay, because they hadn't done that. They're more aviation focused than the space side of things. So that was my personal journey. As I started off with loving flying, loving medicine, and then really for me it was getting into aviation medicine and then the international community and finding more about space medicine, which is really my passion.
Yeah, that's awesome. That's one of the things where, in this YouTube channel, I'm really trying to give opportunities for students to find their passion. I feel like there's always this, moment where that's the thing you want to do for
Yeah.
the rest of your life. And it's, not every student finds it. It's difficult. And throughout your life journey, you end up, hopefully finding it. And so being able to get that at a younger age is definitely an advantage. So it's really nice that you were able to, click with it and you love doing what you do.
Yeah,
And
but also be in a position that I was lucky that, I did pester and did work hard to get to where I am and to find those opportunities. But there's also a bit of luck involved as well. So
yeah, definitely agree. And earlier I was talking about how you want to solve problems of women in orbit. And so I'm curious, what is some research you've done? What are some ideas you have? And what does the future of this look like for you?
so first of all, I do have to correct that newspaper article. I am not the UK's first. My esteemed colleague, Dr. Pete Hodgkinson, was the first doctor to go through. That newspaper did get rather enthusiastic, and so it's not quite true. One of the first, but not the first. Anyway, in solving women's issues in space, women from a physiological point of view do have some differences in comparison to their male counterparts, and they are sorely underrepresented in the space population historically. Not so much now, which is really fantastic. But trying to kind of find research questions and find answers to these things can be a little bit more difficult. So I guess going forward, so there's a very rich academic environment for life sciences, space life sciences in the UK, and there's lots of people working on trying to answer some of these questions to help protect astronauts going forward into the future and on longer duration missions, but also to take those lessons learned from the physiological life science experiments to apply them to us on Earth. And for example, one of those is the bone loss that you see in astronauts. Some of the mitigations and exercises that we do to try and stop that, we've now brought in to protect or to treat people with severe osteoporosis, which is bone loss in a normal 1G environment back here on Earth. So it's the same type of illness, different pathology as to what causes it, but those treatments we really learned a lot from that with regard to kind of aging. So going forward in the UK, but not just the UK, but internationally, is I really hope that we see parity in the numbers of women and men going to space. And as we move towards commercial operations, we're going to be seeing people who aren't these really fit astronauts who are the only types of people that we've seen. So we're going to see people with maybe some underlying diseases, chronic diseases, but stable, that we'll be able to study and learn a lot more from. So going forward, I'm hoping to see equality of the genders in space, and also opening space to more people, which keeps us all in day jobs, making sure that they're fit to go off into space and to support them in space, and just to learn more and a better representation of the population that we have here on Earth in space.
Yes, that is 100%. I completely agree with it. I mean, I think the future of space medicine that excites me the most personally is the fact that we want to include more diverse individuals in space. Currently, the astronauts that are go are the smartest of the smartest, the fittest of the fit. They are they're very healthy, and they're very carefully handpicked. And in the future, when we want to make space more diverse and accessible, especially with commercialization, which allows us to take more people up into space, we really want to be able to allow everyone to go and not discriminate based off of someone's body type, weight, or mass or any of that. So I think it'd be really cool to also, as a doctor, to see how can we allow every single person to be able to go to space if there's conditions, telemedicine being involved. I think just the future of the space medicine is really exciting, and also what we learn from the research that happens in space can also help us find solutions to problems here on Earth, like you were mentioning. So, the future is really.
And have you heard of, well, we're moving in that direction, and actually the European Space Agency, in their latest round of astronaut selection, they're looking for a para astronaut, so someone who has the same academic qualities who previously may have been left out or not selected out because of a physical disability. And they're looking as a feasibility project to try and see if they can adapt hardware within the spacecrafts to accommodate their physical disability. Because once you're in space, we're all, I think Samantha Cristoforetti was saying, we're all disabled. We're all floating around, and we're not adapted to this space environment. So really a physical disability, the loss of a leg or short stature really won't have an impact on your ability to operate in a space environment. So I think that's a really fantastic initiative, and hopefully we'll see more of that in the future.
Yeah, I actually have not heard about that initiative. So that's exciting. That's very
Yes, go and
exciting
have a
to hear.
look.
Yes, definitely. And you were also mentioning, this research that's happening, and I'm sure you've been a part of so many cool projects or research experiences. So I'm curious, if you had to pick one, which it was a tough time for everyone, what is the most exciting project or research that you have worked on or are currently working on?
So that's tough. But one of the reasons I decided to go into aviation and space medicine is because I there was never one part of the human body that I just wanted to specialize in, because I find it all
Mm.
fascinating. And that's what I like about aviation and space medicine is you need to know about all of it. You need to know how the eyes function, you need to know how about the heart and the lungs function in this extreme environment. So I'm one of these people who like to know a little bit about everything. One of the most exciting projects that well, there's kind of two. So obviously my current work is exciting because it's forming the part of my PhD, and I've spent so long on it. I'm in my third year now, so it really feels like it's all encompassing. But I think something I'm very passionate about is the safety and medical risk assessments in analog space medicine. So with the Austrian Space Forum, which I was involved in, I was the medical officer for a 5-week simulation mission in the deserts of Oman, working with Rochelle and the rest of the medical team. And we learnt lots of lessons from that, made recommendations, and Rochelle and I formed a kind of a safety working group to try and improve safety across different analog platforms, because the standards of safety vary between them all. You've got very different types of analog. You have the big professional space agencies that use analogs for astronaut training. And then you have the more kind of academic research type analogs that often can be run by volunteers, and they have very different funding and resources. And so we're trying to raise safety and awareness across all of the different types of analogs, so that they are approached with the same level of safety. So it also gives you better results, because ultimately that's what the analogs are there for, to try and get data.
Yeah, yeah, that sounds very interesting. There's so many smaller aspects that we have to study. And so, the thing about research is you can be so specific and research one specific thing, and it's so impactful to the rest of the industry. So that's just amazing research. And you worked at the Royal Air Force for about 14 years. So I'm sure you've had some great experiences and some knowledge that you gained there. So what experiences and knowledge did you gain as being a part of the Air Force that helped you grow?
So the Air Force has really been a fantastic career, and I'm actually still in the Royal Air Force.
Oh, okay.
I'm just in the US as part of an exchange. So the US send one of their officers to the UK, and the UK send an officer here to the US. So it's kind of it's an exchange program. So I'm still an officer in the Royal Air Force, and I've had some fantastic experiences. Particularly flying in aircraft, and being able to travel all around the world, and being sent to America, which has been really awesome. So I've been very lucky in that aspect. What was the question that you asked?
Like just some experiences that you had that were very informative or maybe transformed you in a way?
Yeah, well, like I say, the flying in aircraft. So as a doctor, you don't often get the chance to fly an aircraft. And
Yeah.
so part of our testing of equipment is we have some fast jet aircraft, some Hawk aircraft that are specifically designed to do testing of equipment and clinical trials. And so my job would be to fly in the fast jet to test some of those things. And sometimes I have to pinch myself that that's a day job. That's really fun. And also getting to work with the pilots and the aircrew, and trying to keep them flying. There's a lot that gets invested into them. Sometimes you can be painted as the doctors are trying to stop them from flying or ground them. But we're not that at all. We want to keep them flying safely. So we do absolutely everything in our power to get pilots to keep them flying. And so that can be really rewarding when you get pilots to keep them flying despite the odds, whereas automatically straight on paper you'd be like, oh, they're never going to fly again, but you can get them back to doing that. And another thing that has been a really awesome experience is aeromedical retrieval. So when I was doing my kind of more acute clinical stuff, I was involved in bringing injured personnel or military individuals back to the UK. And I had some really cool trips in the back of aircraft, looking after sick people to get them back safely. And again, that's another very rewarding job, but very different to the normal hospital type medical doctor role that many people think of.
Yeah, I've met a lot of actually space medicine professionals who were flight surgeons. And, I started looking into it. And honestly, I feel like it's such a wholesome experience. It's not only you working in the hospital, taking care of the patients in the country, but also, being able to save someone and, who's like fighting in the borders. And I don't know, it's just like a really great experience, I feel like. And it's something that I definitely have been looking into. So I know it's definitely like a cool experience because not every doctor gets to, treat someone when, in a helicopter, for example,
Yeah.
or like a jet. I think it's a really cool experience.
Yeah, definitely. It's lots of challenges that give you leadership skills, that give you team working skills, that give you, all sorts of stuff.
Yeah.
It's
And
really
better insight to what's happening and like more stories and more journey. Yeah, definitely. And so, did you always imagine yourself in the position you are in today, or did you have some twists and turns in your journey that helped you become who you are?
So I think one of the hardest things is, as I was kind of going through medical school and I really wanted to do aerospace medicine, I don't think I was fully aware how small it was in the UK. So having met the international community and realizing that it does exist in America and there's this established pathway, and then finding out, well, I'm not American, so actually a lot of those opportunities are not open to me. Oh, actually, this specialty doesn't even exist yet in the UK. Oh, I didn't even realize that. And then so trying to keep the dream alive, and keep my ear to the ground and keep networking, to then find myself in a position in 2016 where, okay, it's been approved now and you're going to be one of the first people to go through the curriculum. That was really awesome. But for quite a long time before that, it was hard to keep believing. And now even in the training job that I'm in, so I'm nearly finishing my residency after I finish my PhD. The opportunities within the UK are few and far between, but one of my passions is to try and increase that representation and grow the specialty in the UK and make opportunities for myself and for others within the UK, because this space medicine is international, and I strongly believe that. And working in America, being here and seeing how developed it is, I'm hopefully going to take some of those lessons back to the UK and try and grow it and strengthen it from there.
Yeah, definitely. Space medicine is so revolutionary across the world for all of us. Being able to provide like those opportunities. I'm sure there are many individuals who might have been interested but never found like a path. So they might have just, not have been as persistent as you to stick with it, and might have lost touch in it. So I think it's great that you stuck with it. And so, were there obstacles for you pursuing your passion? And if so, how did you overcome them?
So the biggest obstacle is not being American, I think. But I overcome that by making sure I networked and found my team, found my people. So I found other people who are involved in the specialty, and I found out about the specialty. And so putting myself out there, paying as a student to go to conferences, and it's hard work networking. And when you don't know anything about a specialty, and putting yourself out there and going up to people who are professors and have been in this
Scary.
specialty for years, but it's such a small specialty and everyone is so friendly, and everyone wants to tell you more about it because um, they found it hard to know about it to get into. And that's why I'm passionate to share my knowledge about aerospace medicine, because I found it difficult to find the information when I was going through those decision making periods. Um, so I'd say access to information is probably one of the biggest obstacles. Um, and so having confidence and having persistence and networking and finding those answers and not taking no for an answer. So, people told me, oh, the specialty doesn't exist. I'm not sure it's going to be around. Go and do another specialty. Like, no, this is what I want to do, and I think it's going to be there. So I'm going to keep on this path and keep going. And when when it did become available, I was there. I was ready. So yeah. So go for your dream A and keep
Go
going
for it.
for it. And you'll have people giving you advice that you didn't ask for along the way, but go and find your people. They will support you and they'll help you get there.
Yeah, and building that support system, yeah, like you were saying, I guess it's important to have that community just so because you're all in it together, even if it's a small group, just having these people you can rely on who believe the same thing you do it's a great environment. And so you were saying that information is key, which I am a strong believer as well. I feel like information is wealth, especially in this age. So was there like a mentorship, internship, a volunteer role that you would recommend to undergrad students or maybe medical students that assisted you in helping you achieve your dreams?
So there wasn't when I was going through, but there are definitely more opportunities now. So in the UK, the next generation of aerospace medicine is an opportunity to find mentors and find your people. On an international scale, I think I mentioned them before, AMSRO, the Aviation or Aerospace Medicine Residents and Student Organisation, reach out to them, find out more, link up with them, and they will then provide mentoring opportunities. So every year at ASMA, which is the Aerospace Medicine Association conference, there is a speed mentoring workshop where you have the most some of the best people in the industry and all different sectors. You go in and you get, I think, 5 minutes with each person, and you can get advice and you link up with people and from all over the world. It's really incredible. So those are the three organizations that I'd say go out, find out information, read about them. They've all got websites online. Join them, find your people. That's how you get to know more about the specialty.
Wow, those are two amazing programs that I wasn't aware of before. So that's really great that there's so many opportunities for medical students.
And I also just want to say that you don't have to go into the pure specialty. Um, and I know that might be quite nerve-wracking for some people, particularly in the UK when there's only
Yeah.
now there's only 6 of us, so it's still really small. You can still do your specialty. So if you really want to do cardiology, still do cardiology, but you can still have a space interest. So again, and the Space Medicine Association has just set up a group for surgeons interested in space medicine. So their primary specialty is surgery, but they're also looking into space aspects of like subspecializing. So again, these organizations will help direct you towards those groups based on your situation, your interests, and help you find the mentors that you need to support you.
That's amazing. I'm so glad there are programs like that that really allow you to connect with people in the industry who kind of have been in the path that you want to go in. That's
Yeah.
amazing. I'm glad that
And
exists.
ASMA do lots of scholarships every year, so it's worth applying to them.
Thank you for sharing that. I know that's going to be helpful for a lot of people who are, looking for these opportunities, especially in the UK. So, the goal of this series is really to show children around the world that you don't have to look like someone or be a genius in math or science in order to be a part of the space industry. Because I feel like space in general is very
Yeah.
stigmatized. There's so many stereotypes. And I feel like when people hear the terminology like rocket science and space, they get really intimidated. So, what is your take on, the unique space careers that are in the space industry?
I'd say overwhelmingly, everyone that I've met in this industry has a passion for the specialty that they're in, because they've had to fight to get there. They've had to fight to find information. They've had to fight to get a training place. So everyone loves what they do, and it really comes across. It's a small, tight knit family, and everyone is passionate about what they do. Everyone, you've got to find that one thing that you enjoy, because you're going to be reading journals at the weekend, you're going to be writing papers in the evenings, you're going to be doing interviews with all sorts of students and trying to tell other people about how fantastic it is. So I'd say above everything else, enthusiasm, passion are characteristics that you need in abundance for this specialty. And yeah, if you've got those and an interest, yeah,
That's all
you're
you
there.
need.
Yeah,
That's the requirement to be a part of the space
for
industry.
sure, for sure.
Yes, that's so reassuring for a lot of students because, I mean, some students, I was talking with one individual, they failed calculus in college and university, and they thought that, okay, that's it. I'm not going to be a part of the space industry. But they ended up, still persisting, and now they work at Lockheed Martin and they're, doing great in the space industry. So I think that's a testament to what you said.
Yeah, for sure. And the space industry is growing, and it's going to grow a lot. So people may say, oh, it's a really small specialty, don't go into it. But if you
Yeah.
enjoy it and you want to do it, go into it.
Yeah, and with the commercialization of space, with a lot of private sectors opening up, and SpaceX really bringing popularity to the space industry, I feel like there's more jobs that are opening up than before.
There are, although I do have to just point out that both SpaceX and Virgin Galactic, who recently recruited for flight surgeons last year, you still had to be an American to apply for those jobs. So
Oh, that's shocking.
again, hopefully it's going to be opening up to other nationalities, but for the time being, it is still very American centric. So that also is some of my advice, particularly to young, early career medical students, is if space, more than aviation, more than aerospace in general, is your absolute 100% passion, then look towards training in the US, because that's where the jobs are. That's where the established training route just for the space side is. Whereas the UK is got a very rich history in aviation and aerospace. It's growing in space side, but yeah, it's America's where the numbers are.
Yeah, yeah, that's a good point. That's a good point to keep in mind. So now that we've gotten a little bit of insight onto some research that interests you, some opportunities, as well as your journey of how you really became one of the first women, in space doctors, I think it's really great that you went out of your comfort zone and stuck with your passion. And so my last question for you is, what advice do you have for young people? And you gave a lot throughout the interview, but regarding their pursuit of a passion in the space field, STEM field, really any industry, an advice that you wish you knew when you were a younger student.
Uh, I think I've said a few of it, I've said it all a few times before. Find out information, ask questions, find your people, and then just pursue it as if it's the only thing that you care about, and try not to take the advice take the advice from people you're asking, but don't listen to the people who give you advice that you're not asking for, if that makes sense.
That perfectly makes sense. Those are four pieces of advice I think is so crucial for every single student out there, regardless of the industry they want to go to, whether the job currently exists or does not exist. Make it exist and just do it. So I think that is amazing advice. Thank you so much, Dr. Posselt, for taking some time out of your busy day to share your story with us and give a different insight. I really appreciate all your time.
And can I just say, what you're doing is fantastic.
Thank you.
It's incredible. If I could have gone and told myself at your age to go and do this, yeah.
Thank you so much. Thank you.
So please keep it up, and I really look forward to following your YouTube interviews with lots of other incredible people.
Thank you.